Everyone, my name is Arthur Pathi,
Hi everybody, my name is Shukla.
and today we're talking about obesity. So the first question, what is obesity and how is it measured?
Obesity can be simply defined as adiposity-related chronic disease. So obesity is measured by a crude index called body mass index or BMI, which is just a ratio of height and weight. The cutoffs for this depend on the ethnicity and race of the patient, the demographic. So for most people, the cutoff for BMI is 30, except for Southeast Asians and Chinese Americans, where it can be as low as 23.
Okay.
You really want to rely on the whole clinical picture when diagnosing obesity. If the patient in front of you is showing signs of insulin resistance, like having prediabetes, some skin conditions associated with obesity, like skin tags, and having higher sugar, higher cholesterol, then you want to dive in deeper despite a normal BMI and look at other indices like abdominal circumference, which has different cutoffs for different ethnicities and demographics. There are more precise indicators like body fat percentage that you can diagnose based on a scan called DEXA scan. That is not as easily accessible, so the access is limited, and that could be a barrier. So for most instance and purpose, you would just be diagnosing based on BMI. If there's a high clinical suspicion and BMI is normal, you would look at abdominal circumference, and rarely you would need to do a DEXA scan to diagnose obesity.
Okay. What are the main causes of obesity?
Very good question. So the plain bread and butter routine obesity that is preponderant is polygenic. There are multiple interaction of genetics and the environment, which most of the population now carries a tendency to have obesity. And then the epigenetics, the conditions growing up and exposure, access to healthy food that can determine their chances of having obesity. And then there are rarer causes like monogenic obesity from certain genetic mutations. Those are not very common, but should be strongly considered in early obesity, like in pediatric cases.
Okay. So what are some simple changes people can take to prevent obesity?
So although we were talking about epigenetics, genetics, and environmental causes, there could be a total setup for obesity, and we could prevent it by some environmental lifestyle controls. But I would advise patients to never blame themselves if they happen to find themselves having adiposity-related chronic diseases manifest, because sometimes you're just dealt with a tougher set of cards. But we can all try our best. In trying your best, I would say some basic things we can do is be very mindful of what we are eating. Looking at the labels would be a habit to incorporate in your daily life. At least in America, there's a certain standard of how the label should be written. You can look it up on CDC food label. If you Google that, it will come up and show you how to read labels. When I'm looking at a label, I'm really looking at the most important thing is added sugar. So that should be as low as possible, ideally 0. For instance, if you're shopping for yogurt, which is a good food category, has protein, right amount of fat, right amount of fermented carbohydrates. So we all agree that's a good food group to have. But if you're not looking at the labels, you could very easily end up eating a yogurt that is unhealthy for you, which has 40% or 50% added sugar. So added sugar is the main parameter I look at. And then of course everybody's sort of used to looking at calories and the portion size, but that's the second thing I would look at.
All right, cool. How can we educate kids at home about eating healthy?
So for really little kids is having a time that is free of any other distraction as a meal time where the family is sitting together. So really being intentional about the setting in which they are eating. Free of distractions like televisions, which can make them lose cue of when they're full. You can see if you're distracted, you can easily lose touch of what you're eating for. You could just be eating because your favorite television show is playing. So really untangling, if that's already a habit, untangling those habits, those rewards.
Okay.
Separate those rewards. TV time is separate from eating time.
Right.
And family eating together, and then providing them a variety of options, at least to try, not to say no to anything, but a variety of options. Is what helps kids develop good habits. We talked about the choices of food, so the choice should be parents' choice and what they're putting, but how much to eat is gotta be your kid's choice.
Right.
So finishing the plate is no longer recommended. You know, back in the day, we were trained to say, whatever you have, gotta finish that.
Right.
So there's no way a parent can accurately measure, this is what my kid is supposed to eat, the caloric requirements.
Yeah.
Rather, you know, the recommendation is to have them be in tune with their body and body awareness of what is full, what is hungry, and then respond to that appropriately.
Right.
So you put a healthy choice of options for their meal, and if they're done, they're done. You respect that. And
right. Yeah, my parents usually just leave it up to me to figure out when I'm full or when I'm not full.
That's wonderful.
Yeah.
Yes, that is the recommended advice.
Okay. So why is support from family and friends important for weight loss or keeping your weight healthy?
Great question. This is like any other chronic condition. It's not a lack of willpower or moral failure or somebody making bad choices. It's not that.
Yeah.
When the body is primed, when your insulin or food system is primed to store energy differently, no matter how less you eat sometimes, that ends up being stored, especially when the condition is gone untreated long enough, like for decades and decades. You're deeper in that spiral.
Yeah. And
everybody's in a different stage. Some people just started gaining weight within the last year and got medical attention. Their journey might look very different from someone who attained obesity classification in their teenage, and then they're living 3 or 4 decades with obesity. It might take a lot more interventions, different types of interventions, and there's nothing to be ashamed about. Could be medical, pharmacological interventions to reset that abnormal system. So your energy balance is a very intricate system between brain, gut. It's not just, okay, I'm hungry, my gut tells me and I'll eat because my stomach is empty. It's not like that. It becomes pathological, as in, even if your body has met for a patient with obesity, even if their body has met with their caloric needs, there is a dysregulated system that keeps telling their system, hypothalamus, to just keep asking for more. So the awareness of being full is not there.
Right.
So sometimes I talk to patients and they'll tell me, I do not know what it means to be full.
Right.
So that, you can leave it very little to the patient. It's not their fault. They just don't know what it means to be full.
Yeah.
So there's homeostatic pathways where there's a balance which is disturbed, like a thermostat gone wrong.
Yeah.
The room is hot, but thermostat keeps dialing it up and up and up. So there's that system governed by hypothalamus, which can go wrong from genetic or non-genetic mechanisms, like hypothalamic inflammation.
Okay.
And then there is hedonic system, which is more like addiction pathways. So just like fentanyl, heroin, cocaine, sugar is a very potent stimulator of the reward pathway.
Okay.
That has nothing to do with your caloric needs, what you need because you're an athlete, you need 2,000 calories.
Yeah.
It doesn't care for that. It will eat because it likes candy.
Yeah.
So that's hedonic system, which is the pleasure reward system is hijacked. That the brain, and that is also a dysregulated chronic state that, over time, as the time goes on, the individual has very less control over it. It just happens in the background without asking for permission.
Right.
So at the end, once you know about these pathways, you realize that there's very little to be blaming or shaming an individual. This is a chronic condition just like any other with multiple pathways, and therefore the treatment also depends on what is going on, and a qualified doctor is able to tease out whether there is genetic condition like Cushing syndrome or leper mutation, monogenic causes of obesity, or there is an abuse of steroids that is leading up to obesity, or there is untreated sleep apnea or heart failure causing them to gain fluid weight. So you have to exclude the medical causes, then go into the duration of obesity, really dive deep into the lifestyle habits and see where an intervention can help the patient.
Right.
Yes.
Cool.